Have you ever wondered why is it that diabetics find it so difficult to change their lifestyle? I find it very interesting how diabetics seem to just love those things that will make their condition worse. I'm Dr. Douglas Street, and I'm going to share with you one of the reasons why diabetics find it so difficult to change their lifestyle. We're going to discuss today the diabetes germ connection. Now, we're going to be looking at the role of the intestinal microbiome in diabetes. Now, the intestinal microbiome is approximately 39 trillion microorganisms inside your body and also on your body as well. In fact, most surfaces of the body contain bacteria and other microorganisms that influence how your body functions. And as a matter of fact, it has been estimated that there are more of these microorganisms than even human cells in the body. But because they are smaller, they're not, and of course, they're not one cohesive organism, they will not really be seen. Now, the gut microbiome, which is the bacteria and other microorganisms inside of the intestines, there are over 1,000 different species of these bacteria. And of course, there are different types of bacteria, as I said, and the balance between the bacteria actually makes a difference in terms of how they function. So the actual bacteria that are there and the composition, the relative percentages actually makes a difference. In other words, the balance of these bacteria make a difference in terms of health. Now, one of the reasons why they impact the body so much is because 70 to 80% of the immune system actually lives in your intestines. And of course, these interact with the bacteria. So if you don't have the right balance, then of course, it's going to negatively influence your immune system and that can lead to certain consequences. Now, another fact that you'd want to be aware of is that there is more genetic information in these bacteria than you find even in our own human cells. And this is important because they do affect the function of the body. They do perform important roles. And this is part of the reason. They actually do things that are important for the body to function. So they are very important for our health. Now, there are several things that these bacteria do. They actually help to digest some of our food. As you know, not all of the food that we eat is digested in your intestines. Some of it goes into your colon and is further broken down by the bacteria that are there. And the breakdown products actually utilized by your body. And I said because it interacts with the immune system, it does have a significant impact on your immune system. And it also interacts with your brain because there is what we call a gut-brain axis. There's a connection between the gut and the brain, mainly through the vagus nerve. And this actually is like a highway of information that flows back and forth. So these bacteria actually, you could say, speak to the brain and can influence how the brain functions. Now, these microorganisms, as I mentioned before, they do help us in the digestion and absorption of certain foods, and they can even produce certain vitamins for our bodies to use. So they are actually very, very important. Now, these bacteria kind of modulate your immune system, and you find that when it's not there in the right balance, then you find that the immune system may not function the way it's supposed to function. It may be overly sensitive or it may not be sensitive enough. So the right balance is important. And of course, when you have what we call an imbalance in the bacteria, you do find that there is an increased level of inflammation inside the body, not just in the colon, but in the entire system. So it's very important to maintain that right balance of the bacteria in your intestines. The balance between the bacteria in the intestines, when you have an imbalance, it can actually increase the chance of you having certain disease conditions. And this is not an exhaustive list by any stretch of imagination. does increase the risk of you having on excessive weight. It can also increase the risk of you developing diabetes and also mental illnesses. So things like schizophrenia, things like the anxiety and depression, post-traumatic stress disorder, all of these are actually linked to an imbalance in your intestinal bacteria. Now, research actually suggests that if we can intentionally modulate these bacteria, in other words, affect the balance of the bacteria through diet and lifestyle and probiotics, etc., prebiotics, then it can actually have a positive effect on many disease conditions and of course diabetes, no less. Now, it's also been found that when you have an imbalance in the bacteria, it can even affect the medications that you use. It may reduce the effectiveness of some of these medications, and it has been found that, for example, the effectiveness of certain cancer drugs can be affected by the imbalance of the bacteria in your intestines. So it is an important thing to understand. Now, how do these bacteria, how do they influence the development of diabetes? Now, what has been found is that in diabetics, there's an imbalance in the bacteria. So, and this is something which has been found quite commonly. You do find a decrease in the beneficial bacteria because, of course, there's a saying about good and bad bacteria. So what you find is that in diabetics, you find a reduced amount of these beneficial bacteria and an increased amount of the the harmful bacteria in your intestine. So you can definitely see a connection there. The gut microbiome, the bacteria, they do affect how well your body absorbs and utilizes glucose. And they also can enhance the production of inflammatory metabolized substances that are produced in the body that can increase inflammation. And then this can lead to excessive inflammation in the body, which reduces the effectiveness of insulin and can lead to diabetes or its progression. And you also find that it may affect the brain, and it can actually enhance the appetite of persons. And of course, this is not a good thing for a diabetic who would need to regulate their diet better. And of course, it affects their satiety. In other words, they may eat more than they normally would, and it may affect the way that their glucose is utilized in the body. Now, it's very important to understand that that these bacteria, they can actually affect your motivation. No, and of course, this is very important as a diabetic, because if you're not motivated to do the things that you should do, then it's less likely that for you to do them. What has been found is that these bacteria actually can encourage you to eat those things that you should not. Um, so for example, you've heard of persons who have a sweet tooth, right? And it, of course, has nothing to do with your teeth. It's not a dental issue. But you do find that when you have abnormal bacteria that may encourage the development of diabetes, what you find is that it can actually encourage persons to eat sweet things, and not just things that are sweet, but there are other things that may trigger inflammation in the body that these bacteria can encourage them to do. And of course, the things that they should be doing, like the exercise and the drinking of the water and getting enough sleep, you'll find that these bacteria can actually discourage those behaviors. And of course, as we said, the bacteria, the imbalance in the bacteria can actually cause depression. It can cause mental illnesses. Of course, if a person is depressed, then the motivation will go down. So this is a very important reason why the balance of the bacteria is important, because it can have these effects on a person's behavior. So it's not just effect on the disease itself, it also affects your motivation to take those steps that will allow you to do a better job of managing your diabetes. Let's just look at some of the symptoms, because of course, these symptoms can tell you whether you have this imbalance or not. Let's look at some of the gastrointestinal symptoms, and these include bloating. puffiness in the tummy. You may have belching, and you may have passing of gas, and you may also have abdominal pains, cramping or tenderness in the abdominal area, especially the stomach area. You may have constipation or diarrhea, and constipation is usually one that is most common. So if you're a diabetic with constipation, then of course that is something that you need to pay attention to, because the what is causing constipation may also be contributing to your diabetes. The nausea and vomiting, which may also happen as well. And then there are non-gastrointestinal symptoms, and these include things like fatigue, tiredness all the time, even though you get enough sleep. You may not feel rested. You may have mood changes, things like irritability. You may have mood swings. You're easily upset and easily angry, and these may be symptoms of an imbalance in the bacteria. And of course, there are others, like it may affect your skin when you have an imbalance in the bacteria. You may have certain skin issues, things like acne, eczema, psoriasis, and other skin conditions. You may also notice weight changes. In other words, usually this is weight gain, right? So of course, chances are if you have an excess weight, more than likely you may have an imbalance in your intestinal bacteria. Joint pain is another common symptom of the imbalance that we are speaking about. And of course, you may have respiratory symptoms, things like nasal congestion, sneezing, shortness of breath, coughing, and you may also have brain fog. You may have memory problems. You may be, forgetful. You may have difficulty concentrating as well. And you may all have immune system issues, things like infections very easily. You may even have autoimmune diseases as a result of this condition, or allergies. It may affect your hormones as well. You may find that this imbalance in the bacteria can cause it to have hormonal problems like thyroid problems, adrenal fatigue, and other hormonal changes. You may have difficulty sleeping as well. You may have insomnia, or you may have excessive sleeping. So either one of them can be a symptom of this imbalance. You may have difficulty when you're trying to eat certain foods. You may be overly sensitive, and gluten sensitivity, lactose intolerance may actually be a result of this problem. You may have excessive reaction to histamine as well. You may notice that you're very sensitive to light, and so on to say that, for example, migraine is somewhat related to an imbalance in the bacteria as well. And of course, in migraine, you have sensitivity to light and sounds. But you may have that even without the migraine. You may be also overly sensitive to certain environmental toxins that may not affect other persons as much. So, so that is something to take note of as well. You may have, as mentioned before, autoimmune conditions, things like lupus and rheumatoid arthritis, multiple sclerosis. These conditions are linked to 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 imbalance in the bacteria, and this is why you find that diabetics, this is one of the reasons why diabetics are more likely to have these conditions. If you notice, these hormonal conditions, depression, anxiety, all these things. There is a connection between the diabetes and these conditions, because the imbalance in the bacteria can cause both of these situations. So you do find that a person with diabetes is more likely to have depression or anxiety, because the imbalance can actually cause both conditions, even bipolar disorder as well. All these conditions are linked to an imbalance in your intestinal bacteria. So what can cause the imbalance in the bacteria? Of course, that is one of the main things. Something that you don't want to really make note of is that fiber helps to feed the healthy bacteria. What you find is that in order for you to encourage, the healthy bacteria, you have to get a lot of fiber. When you don't get much fiber, what happens is that you encourage the bacteria that are better at extracting energy from low energy foods. In other words, foods that don't have much fiber. This fiber is food for the bacteria. So when you don't get enough fiber, you encourage the growth of other bacteria that are better at extracting these nutrients. But the problem with these bacteria is that they are the are the harmful ones. The harmful ones are better at extracting energy from these low fiber foods. So you encourage them, and then, of course, you pay the price with increased inflammation and all the things that follow. Foods that have high sugars, refined carbohydrates, these also encourage these bacteria as well as the processed foods. So these also are low fiber foods, and they encourage the growth of harmful bacteria. The preservatives and the additives that are added to these foods, unearthly fats, they encourage the harmful bacteria. So these are things that you really want to stay away from. Food that don't have much colorings. With, for example, we don't get enough fruits and vegetables in our diet. Don't get enough whole grains. We're going for the refined carbohydrates, like the white flour and the white rice. These don't have much food for your intestinal bacteria, for the healthy intestinal bacteria. The lifestyle also can affect the balance. Chronic stress actually can affect your intestinal bacteria because of that gut-brain axis that we spoke about. Stress can actually cause a change in your intestinal bacteria, which can increase inflammation. Lack of sleep also, because sleep actually can promote the growth of healthy bacteria. So you want to be getting enough sleep to encourage healthy bacteria. Not not enough exercise can actually encourage unhealthy bacteria to flourish in your intestine. Smoking also can affect the balance, and also your body processes toxins. And then there are environmental, factors like eating foods which contains antibiotics, using antibacterial, substances in our homes, for example, cleaning our surfaces, floors, and so on excessively with things like bleach and disinfectant. These can affect the bacteria that get into our system and can encourage the growth of these harmful bacteria. Pesticides and herbicides in our food, also heavy metals like mercury, lead, and arsenic. Even the air, even air pollution can actually encourage the growth of harmful bacteria. Traveling in and of itself, changes in environment can also cause it. And when you don't spend enough time in the external environment, trying to stay clean, so you don't want to go in the dirt, or you have children, you don't want them to play in the dirt. You don't go into the forest and interact, with the plants and those other surfaces there. Of course, children who are born via cesarean section, um, they are at a higher risk of developing these conditions as well, because, of course, passing through the vaginal passage can actually help the child to start off with a healthy mixture of bacteria in their gut. When you bypass the vaginal tract, then you may more likely to end up with an imbalance in your intestinal bacteria, because the bacteria that you start off with are those in the hospital environment. Then you have medications. There are a lot of medications that can affect, the balance of the bacteria, and we look at those a little more later. Hormonal changes like pregnancy. Pregnancy in itself can actually trigger a change in your intestinal bacteria, yes. And that is part of the reason why you'll find that pregnant women tend to have these problems like allergies and increased blood pressure. And also your blood sugar may go up because of the change that takes place. This is one of the reasons why pregnant women tend to get gestational diabetes, because of the changes that take place in your intestinal bacteria. And of course, it may also lead up to them having, postpartum depression and on, those conditions after postpartum psychosis. This is a reason why pregnant women tend to have those problems, and you may find that there's a combination of these conditions. When you go through puberty, also there's a change, and of course menopause. And again, this is one of the reasons why postmenopausal women tend to have more health challenges than those who are premenopausal. So you see the connection between, the intestinal bacteria and all of these conditions. Very important to understand. It actually helps us to understand a lot of what happens to us, especially as we get older. Now, there are certain conditions that we generally have this imbalance in the bacteria, like, for example, Crohn's disease, ulcerative colitis. There is usually an imbalance in the bacteria in those conditions. As I mentioned before, going through surgical procedures can actually cause this imbalance as well. Gastric bypass surgery, having cesarean sections, and aging in of itself. When you age, you tend to see a change in the balance of the bacteria. And unfortunately, it's one that tends to promote inflammation, which is again why you find that older persons tend to have more health problems, including mental illnesses, suicidal ideation, depression, and anxiety. You find that these conditions are more common in older persons because of the change that take place in the balance of the bacteria as we get older, unfortunately. And we're going to just focus some attention on the medications. Broad spectrum antibiotics, this is one of the things which actually can change the balance of the bacteria, which is why antibiotics must be used prudently. Antibiotics should be avoided when they are not needed, when they are not helpful, and because this is one thing that can happen. Proton pump inhibitors, things like omeprazole and lansoprazole, these medications reduce the acidity inside of your stomach, and then because of the reduction in the acidity in your stomach, what happens is that the population of bacteria that passes through your stomach changes, and evidently your gut bacteria changes, usually to one that promotes inflammation. And the interesting thing about it is that this inflammation that is triggered by the imbalance in the bacteria by these medications can actually affect the stomach, causing you to have inflammation in your stomach, which will encourage you to continue taking these medications. So what you have there is a vicious cycle, right? So it's very important to understand that these medication, proton pump inhibitors, should really not be used persistently. What should be done is that it should be used for a short time, and the inflammation that is causing the stomach problem should be addressed. Histamine 2 blockers like ranitidine, these are also medications that reduce the acidity in the stomach, and these can cause the same issues that we're speaking about. And another interesting one, the non-steroidal anti-inflammatories, things like ibuprofen, diclofenac, and naproxen, and there are a whole lot of others. These medications also are used to treat, joint problems, and they can cause an imbalance in the bacteria. Now, I want to just let you remember something very, very important here, right? Now, we mentioned before that the imbalance in the bacteria can cause joint pains, right? So, what you're going to take for the joint pains? Non-steroidal anti-inflammatory usually. The non-steroidal anti-inflammatories, or the NSAIDs, can cause an imbalance. So what you have there, another vicious cycle. You're going to be taking a medication that is treating the symptom of joint pain that can actually cause the joint pain. Again, these are medications that should really be used for a short time, not long term, because of the potential long-term effects. And of course, they can cause other problems, like, they can increase your blood pressure, they can affect your stomach, they can affect your heart, and so on, the kidneys, the liver. So these medications really should be used sparingly and not as frequently as you find them being used. And certainly, they should be used for short periods. The problem that they are being used to treat should really be addressed in a definitive way. And there are other medications which affect it, like steroids, as we have mentioned before in previous presentations, antidepressants. And again, another vicious cycle. Imbalance in the bacteria can cause depression. Medication that treat depression can cause an imbalance. So you find there another vicious cycle. Antipsychotics, and of course, another vicious cycle. Antipsychotics are used to treat psychotic disorders. Imbalance in the bacteria causes psychotic disorders. So again, you may find a vicious cycle there. Metformin, though, which is a medication that is used to treat type 2 diabetes, it can actually bring about positive changes in your intestinal bacteria, right? Which is one of the reasons why metformin has so many benefits, because they are linked to the anti-inflammatory action that it has. So what are some of the other ways which you can improve the balance in your intestinal bacteria? Well, fiber-rich foods, getting food with lots of fiber, your fruits and vegetables, your whole grains, your legumes. These are very, very important, and that's why it's important that diabetics have these foods every day. Every meal should consist of these foods. phenol-rich food, things like berries and apples and grapes, green leaf vegetables, nuts and seeds. These foods with antioxidant properties can actually help to improve the balance in your bacteria. Also, there are the prebiotic rich foods like honey. Of course, we want to encourage honey in diabetics. Onion, garlic, and asparagus. Omega-3 rich foods like the fatty fish and the flaxseed and chia seeds. These may actually be very helpful. Yogurt and other fermented foods like kefir and sauerkraut, kimchi, miso, and tempeh. These foods actually have been shown, to improve the balance in the bacteria, especially the kefir and so on. And then you have supplements which contain pre and or probiotics. These may actually be helpful in improving the balance, getting enough water. Also, is can be positively influential on your gut bacteria function, getting enough rest, as I mentioned before. Exercise is also beneficial. Spending time in nature, interacting with the trees and doing your gardening, spending time out in the soil. The soil actually contains bacteria that may be helpful to improve the balance in the bacteria, in your gut. And of course, there are other things like avoiding smoking and so on, limiting the medications that are used as much as possible. And these may actually benefit the balance of the bacteria in your gut. Thank you very much. And make sure that you share this video and stay tuned for more videos on my channel that will help to show you how you can achieve diabetes remission. Thank you.